Geneva. We're joined by Winnie Byanyima, Executive Director of UNAIDS, and also by Bineta Diop, who is the African Union Special Envoy on Women, Peace and Security, and the founder of Femmes Africa Solidarity. She's also joining us from Geneva. I'm going to start the call by reminding everyone that you can ask questions in the Q&A function of Zoom. So please put questions there. We have people lined up already with questions for all of our panel. But to start the call, I'm going to ask Dr. Moeti to bring us up to speed on the latest developments from her base in Brazzaville. Dr. Moeti.
Yes, good afternoon to everyone, and thank you very much for connecting with us. I'm very pleased to be joined today by Ms. Winnie Byanyima from UNAIDS. Hello, Winnie. Good to see you again, virtually. And Ms. Diop, the African Union Special Envoy on Women, Peace and Security, and also the founder of Femmes Africa Solidarité. Thank you so much for having joined us. We know that women are often the primary caregivers in families, especially for children and dependents, and they play a very important part in health, making up 70% of the global health workforce, particularly as nurses who provide really primary and essential care in all our health systems. In recent months, African women have been immediately and disproportionately affected by the so-called lockdowns because of the type of work and the role that they play in families and in economies. Many women work in personal care, sometimes running businesses as hairdressers, personal caregivers, and also women are very much active in the informal sector of the economy. So the physical distancing related stay-at-home orders have affected women's businesses, their ability to earn their daily living, and they've also, in some cases, unfortunately, exposed women who are involved in abusive relationships to a higher risk of violence, gender-based violence. Although overall in the African region, women account for around 40% of COVID-19 cases, we've seen a range of this from about 35% in some countries to over 55% in South Africa. And we need to look more and more at the situation here. In the first quarter of this year, compared to 2019, there are reports of drops in access to essential services for people, including for women. For example, fewer women are accessing oral contraceptives and attending antenatal care visits, as well as fewer deliveries being carried out in healthcare facilities. There are broadly reports in disruptions to sexual and reproductive health services and other essential services for chronic care. And I'm sure Winnie will be sharing with us the situation as far as HIV/AIDS care access is concerned. If people who are normally going to go for care cannot go, in the end, they will have to be cared for at home, and very often it is women who have to step into this breach. This lack of access to care is a great concern to us because there are an estimated 196,000 maternal deaths in sub-Saharan Africa each year, accounting for 66% of the global total, and 900,000 newborn deaths, or 1/3 of the global total. So we are working with governments and partners to find ways to continue to deliver essential services, including the provision of personal protective equipment to healthcare workers, many of whom are nurses, many of whom are women. Over the past 4 months, with colleges of nursing in Africa, we've provided targeted virtual trainings to over 1,000 nurses and midwives. In West Africa, this training has been cascaded beyond the capital cities subnationally using virtual platforms, thus allowing as many nurses as possible to be trained in case management for COVID-19 and also, very importantly, in infection prevention and control. Turning then to a brief update on the COVID-19 pandemic on the African continent, there are now more than 265,000 cases, and sadly, 7,000 people have lost their lives. In the African region, the 47 countries that we manage, 8 of the 47 countries account for 84% of the new cases. So we see that there is great disparity or variety in the way that countries are affected by the pandemic. and this is in the past 7 days. 5 countries account for 80% of COVID-related deaths in the past week in the African region. The majority of new cases are being reported in specific hotspot provinces and districts in the countries concerned, generally where the virus was initially identified in imported cases. In several other countries, while the total cases remain low, community transmission and high increases in new cases have been reported in recent weeks. So we see that the situation continues to evolve, to ebb and flow based on what governments and partners are doing. As social measures, including the restriction of movement, are eased in countries, it remains very important that all communities are able to identify, test, isolate, and care for COVID-19 cases, and to trace and isolate their contacts. We are continuing to work with partners in supporting governments to decentralize and scale up the core public health capacities, as well as organizing outreach services to provide essential services. Using these measures, Seychelles, for example, has not reported a new case for more than 70 days. That's over a couple of months. Mauritius has not reported a new case in 10 days. And countries like Namibia and the Gambia are reporting very few new cases. This progress is very encouraging, and we need to continue to note it. And we'll continue working day and night to assist countries to respond to the pandemic, to save lives, and more broadly, to make access to quality care without financial hardship a reality for all people in Africa. I very much look forward to our discussion today, and thank you once again for having joined us.
Thank you so much, Dr. Moeti. Winnie Byanyima, as Director of UNAIDS, you're obviously responsible for ensuring the health and well-being of people living with HIV across the continent. How has the COVID pandemic impacted those people? And can you tell us a little bit about what your agency is doing to help support them?
Thank you. And it's a great pleasure to be with my sisters on this panel, Chidi and Bineta. Thank you for the invitation. The coronavirus has found the world very unequal, and these inequalities are being made worse by the coronavirus. In Africa, which is now really the second most unequal region in the whole world after Latin America, it's very alarming. We have the highest burden of HIV in the whole world, and also of highest burden of other diseases as well. So coronavirus has found Africa weak health-wise and weak economically, vulnerable economically. And this is a serious, serious threat. Here's some of the data that tells you just how vulnerable we are health-wise. In more than 40 African countries, user fees are charged in health. How can you fight an epidemic when you have to pay out of your pocket to access a health facility? Look at what we have. We have, say, in a country like Zambia, just one doctor for every 10,000 people. Italy, which has one doctor for every 240 people, was overwhelmed by the virus. But look at us and the difference we have in terms of the health facilities and what the rich ones have, and yet have been overstretched. So we are weak health-wise. Our health systems, we've been investing less and less in them as a result of mounting debt and slowing economies. The debt situation has pushed African countries to increase their debt servicing by, in a case like Zambia, 760% in 3 years, resulting in a cut in health spending by 30% cut. So you see the trend. We were squeezed in terms of how much we could invest in our people's health because Africa was paying debts. And this is also the time we now need to step up and invest heavily in fighting a second pandemic on top of HIV. So Africa has a difficult situation. And this is not to mention locusts, floods, landslides, droughts that have also been hitting us and are hitting us as we fight the coronavirus. I just salute the leadership of our African leaders who have been able to prevent, to put in strong prevention measures. Coming back to HIV, we have estimated using our modeling that if the pressure, the financial pressure forces African governments to drop health services, HIV services, prevention, treatment, and testing in order to fight corona, which we see is happening on the ground, diversions from HIV to corona because of difficulty in managing two pandemics. We've estimated that within 6 months, we could have additional deaths, AIDS-related deaths of up to 500,000 on top of what we have already. We've estimated that there could be a reverse of gains we have made in preventing mother-to-child transmission of HIV that could set us back to 10 years ago. Pretty bad. So there is a need to keep the fight against both epidemics going at the same time. And that requires resources and the empowerment of communities. So we're saying one of the solutions that must kick in quickly is more ambitious debt relief and cancellation to free resources. We are also saying that the approach to fighting the coronavirus must be multi-sectoral and put communities at the center. The scarce resources which are there, we can't afford them passing over people's heads just like that. Communities are key to fighting an epidemic. That we know from HIV. Communities find the solutions for prevention, for behavior change, for identifying cases, isolating them, taking them for testing. You rely on communities, so you need communities at the center. We are saying human rights matter. Lockdowns we are seeing in Africa are being applied without discretion. And people who don't have normally don't enjoy their human rights, vulnerable groups, excluded people, are finding themselves restricted, constrained by the lockdowns from accessing the services that they have been obtaining. So human rights, monitoring them and respecting the human rights of everybody is key. We are seeing sex workers in Africa being denied the supports that other people are being given, like food. Some of them are being shamed and run out of their homes and called the source of corona. This is a way not to win against an epidemic. We are seeing gay people also being imprisoned because they are accused of being the cause. So human rights violations are a serious concern for us. We won't beat corona without the respect for human rights of all people. Let me end by talking about women and girls. We've seen, as I said, epidemics worsen inequalities that are existing. We are seeing a peak in gender-based violence. Girls and women are returning home to be locked down where they should be safe, and there's no safety. We need more vigilance and empowerment of communities, of girls themselves, to protect themselves, to speak up and to report violence against them. We need campaigns to make people understand that girls have rights, women have rights in their homes. So, and shelters and support for victims and survivors. But it's a shame that women are suffering abuse because they have to return home and because men are returning home. We need to speak out, leaders need to help us there. Girls who are coming back home now and are not going to school, all kids are at home because of lockdowns, millions of them might never return to school. We know this because girls already struggle, parents struggle to keep them in school. Many might even get abused and get pregnant and may never return. So these risks, we have to work hard to reduce them for girls who are more vulnerable. So I want to leave it there for now and come back in to speak about solutions, more solutions for Africa. I'm particularly concerned that our great leadership of the response in Africa, our African Union and its Center for Disease Control, are doing everything possible to pull resources, to buy test kits, to increase testing, but they are at the back of the queue because the rich countries buy up personal protection equipment, test kits, and they have to wait to buy what is remaining. It will be worse if a vaccine is found. Money has been put down, vaccines are being tested now, piloted. When it comes down, we are insisting it must be a global public good. Africa we can't afford to be in the back of the queue, people dying while others are stocking for themselves to survive the coronavirus. This happened with HIV. It mustn't happen again with the coronavirus. So UNAIDS is leading this pressure public demand for a global public good. We are part of the effort by WHO to establish this shared pool of technologies, the CETAP, where we are framing the guidelines so that technologies that are innovated become shared, and manufacturing and distribution is in every region and everyone is reached for free. I'll stop there.
Thanks, Winnie. I know we've got a lot of questions from people on the line who'd love to quiz you and our panelists on these things. I want to bring in Bineta Diop. Bineta, UN Special Envoy on Women, Peace and Security, but specifically, I think today you want to focus on the situation in the Sahel and the Horn of Africa. What can you tell us about the situation there and perhaps more broadly?
Thank you very much, Adrian, and let me greet my sisters, Winnie and Dr. Moeti, and all the journalists who are with us today. I think Dr. Moeti have said that it's been now 4 months that we detected the first virus, the first infection in Africa, which we call the invisible enemy. And we have found that it has gone beyond the health crisis to turn into a socio-economic. But here I want really to emphasize the security threat to individuals, families, and communities. This enemy has revealed that there are vital gaps in the social system, it has been said, but also the impact. We will not have enough data to talk about the infection of women, even if there are data that exists maybe at country level. We didn't have enough time to analyze to see the infection rate between the men and the women in our continent. But what we know that is this pandemic is characterized by dramatic cases, and we have talked about it, sexual and gender-based violence, which the UN Women have called the shadow pandemic. But also, as we know, a UNFPA study with the think tank have come with the estimation that in 6 months of lockdown, it could result of additional 31 million cases of gender-based violence in the world. So I think this is just something that we need to take into consideration to fight the pandemic, but also looking into the impact on the women in our continent as well. You know, recently I was in a discussion with a young girl, which is called Ria from South Sudan. She organized a peaceful demonstration demanding the end to impunity. You know, an 8-year-old girl have been raped, 8-year-old, a pregnant woman who have been raped. So she was demonstrating with her colleague to say we want justice. There are many cases. We call this crime against humanity, especially when it comes to millions during this period. So indeed, when you look at the other aspect in refugee, and you can see in the Sahel, either it is also in the Great Lakes, in the Somali, and I give a case, maybe Dr. Moeti can talk about the refugee camps in Dadaab, refugee camps in Kenya or Kakuma. We trace, infection, it started, and the majority are women and the girls in those camps. And we know that the numbers of people in those camps and the proximity that they have, how do we make sure that the protection that are given to the community, the host community, are also given to the refugee, especially the women, when it comes to distribution of food, when it comes to the protection material. So I think what we can say is right now, during the curfew as well, we have seen, and the lockdown, security personnel have been deployed into the community because they are the one that are confronting, to make sure that people stay at home. But it's also confrontation with the young people and the women who have lost what we say their job is not even a job because they lost their income being in informal economy. Winnie have said it. The majority of African women are in the informal, in the market. They lost their job and they ask them to stay safe at home. So definitely, I can say COVID-19 impact has the face of the women, in particular in our continent, because of the situation. They are disproportionately affected than the men. So, but despite this situation, when we look at the Ebola, we have seen that African women are resilient. Our community are resilient. Maybe that's why we are seeing maybe the way that we are coping, even though our president and leadership are doing their best, but the women themselves are resilient and they are playing critical role in defending this disease. I have followed in many countries in the Sahel, when it comes also in other places where women are the one sensitization. It's not just the member state, even though we need to salute, like Winnie and Dr. Moeti have said, the fact that President of South Africa, the chairperson of the African Union, Moussa Faki, the chair of the AUC, but also the CDC. We have seen strong leadership by making sure that we put protection material, even it's difficult to find in the market, establishing what we call the PAC, and making sure that the procurement system are in place. But what I wanted to say is that the women leadership matter. I'm very happy to see my two sisters here who are great leaders in their own rights, but also in the system where they are working. We'll make sure that in the system we are putting in place in Africa, the women lead. Without that, we go still business as usual. And COVID have shown that we should reverse. We need to go back to the issue of equality, making sure that women's rights are respected, because these are the root causes that we have seen of our violence, but also our insecurity. We need to work on that. I can here testify that ministers, the female ministers of health, the female ministers of finance, the female ministers of foreign affairs. Recently, I was organizing women leaders with head of state, Ellen Johnson, but all the other female head of state to bring the human security, the human dimension that we are missing, to look into the education system, How do we make sure that the young people go back to school? Difficult to, leave them behind. We need to do double effort, but all our guidelines that we have developed by those leaders in Africa need to be at the center of the solution. It needs to be part of the discussion. It needs to be anchored, as we said, in the solution, the scenario planning, the option responses, and the recovery scheme. I stop there. Yep. And we'll be glad to contribute further in the question to come forward. Thank you very much.
Bineta Diop, thank you very much. And I want to turn, if I can, to our first question from Irene Ubani at Plus TV Africa. I just want to see if Irene is on the line.
Hello.
Irene, hello, you're on.
All right, thank you so much. My name is Irene Ubani and I'm representing Plus TV Africa. Now, my question is, how can we get the government to incorporate measures to address gender-based violence and child protection in COVID-19 response and recovery plan?
Thanks for that question. Dr. Moeti, can we turn first to you for an answer on that?
Yes, thank you very much. Last night on TV, I was watching the president of South Africa, President Cyril Ramaphosa, make a really profound, articulate appeal to the nation, declare, in fact, the situation, as Winnie said, and also Bineta, that this situation is itself another pandemic, and appeal to people, not only those who support this cause generally, appeal to men, appeal to society, appeal to those who set norms. I think one of the things that's very important is for leaders to speak out and recognize that this is happening, and then make it part of the interventions that are put in place to mitigate against the impact of both the pandemic. It's been described very much in terms of economic impacts that also makes women even more vulnerable, and the violence itself. I think that the implementation of some of the measures that have been put in place in countries around educating people, the measures with the legal system, the police, the role that they are supposed to play in terms of prevention, and I think the healthcare workers as well, working with men, I think it's something that is very important to do, as well as working with women's groups and those organizations that provide women a way out, shelter if women need it, call numbers that people can call, places where people can seek help, need to be supported, need to be part of the response, the sort of, if you like, the socioeconomic mitigation part of the response to the COVID-19 pandemic. These are aspects that need to be, in our view, thought about now that we have data, that we've actually seen that there's a spike, not only in South Africa, but in many other countries in Africa and in the world as well. They need to be an integral part of the programming, resourcing, action around the impact mitigation of the pandemic.
Thanks for that, Dr. Moeti. We've seen responses from Nigeria, from governors. You mentioned Dr. Ramaphosa. Winnie Byanyima, I just want to turn to you and ask, from UNAIDS perspective, what more could governments be doing to tackle gender-based violence?
Well, with gender-based violence, we have been working in the women's movement. Bineta here and I have been in the trenches for more than 25 years, fighting for, first of all, legislation. Legislation now, most of our African countries have legislation against gender-based violence in various laws. Then we've been fighting to get political leadership on this question. There we have not been so successful. I so rarely hear a male African leader speaking and leading on this question. I give a lot of credit to the chair of the African Union, President Ramaphosa, because he has made it a big issue for himself mobilize, put in place a structure, laws, a budget, and everything. But most other leaders leave it to others, yet it is a pandemic, a silent one too. So we need more political leadership. We have to put the responsibility on our political leadership. Secondly, there are actions for prevention and there are actions for response. I feel that on the response side, there's been a little more effort, like building polices that understand their role, building judiciaries that can prosecute. More, money has been invested there a lot in the last 20 years from government budgets, though not enough. But on the side of prevention, that is where we are weakest in my view. I wonder what my sister thinks, but I feel that you need aggressive campaigning and discouragement of the violent behavior of boys and men, the way they see their masculinity and exercise it. That discouragement needs to happen. And governments leave this to the civil society, to women's organizations. But really, it is the business of government to invest in continuous campaigning in communities to change how people live and how relationships are managed, to extract violence out of them. And this is a lot about male behavior, the way men are raised and see themselves as men. So tackling toxic masculinities is something not well invested in by our governments. Then empowering communities and girls themselves in communities, putting all girls in the school. We know, for example, from the HIV side, that if a girl can stay in school throughout primary and secondary and finish high school, her vulnerability to HIV is reduced by 50%. And even her vulnerability to sexual violence, to early pregnancy, teenage pregnancy, early marriage, all those are reduced significantly. But our governments have only got as far as primary education. 2/3 of our children are not in a secondary school. So those are the prevention measures, some of them where I feel we need to concentrate. This issue of secondary education, its time has come. We fought for primary education, universal primary education at Beijing. Within 10 years, we had achieved it. Now we need to draw the line and say every government worth its name must put all its kids, boys and girls, in a classroom to finish high school, to be part of the knowledge economy, but for the safety and the empowerment of girls and fighting gender-based violence. So these are some of the things I feel, but I defer a lot to my sister Binta. She's been at this much longer than myself.
I want to bring Binta in, but first I just want to hear from Carly Patesh of Associated Press in West Africa. Carly, your question's also on gender-based violence. Perhaps you can put that.
Yes, hello. Thank you for speaking on this very important topic. And it sounds like you're giving a lot of solutions. Some countries have been reporting the increase in both rapes and gender-based violence since the lockdowns. Can you go into more depth about what you're seeing and what regions or countries are seeing the biggest increases and perhaps why? Was anything put in place before? And then I welcome you to expand on what more can be done to help prevent this.
Thanks for that, Carly. And I want to turn to Bineta Diop to address that, if we may.
Yes, I think I will follow what Winnie have said in terms of leadership, because leadership matters in the solution that we are discussing. Of course, when we look at the society, especially the system that have put discrimination at the front, where women are not being at the center of the development agenda, or a peace and security agenda, and we are considered as second citizen. I think that the patriarchal system that Winnie have also described, I think those are some of the root cause that we have seen. But when it comes to the lockdown, I think also Dr. Moeti have said why women are facing in the lockdown in front of the male counterparts, why also this kind of violence are happening. We have seen cases in South Africa, a lot of cases in Nigeria as well, but not only on those two countries. Every day we follow, we have seen in countries of conflict in South Sudan, but also where we've seen also the fighters, the extremists, the fundamentalists, those who are in the Sahel or the Lake Chad Basin. So this is double lockdown of the women, because they have been locked down because of the kind of violence they face every day, but now there are double lockdown. So let me, like Winnie have said, look at this in the terms of solution, because we need to find a way that while we are fighting the pandemic, we should not distract from the prevention of violence and this conflict and the impact on the women. First of all is justice. I think the perpetrators, have to be brought to justice. And that's time that we fail, because leaders will come most of the time and claim that they have zero tolerance policy. But when it comes to implementation, we found that there are a big gap between the declaration but the implementation. Those who are perpetrators should be brought to justice. So then you are asking me, how do you identify them, that they are perpetrators? I have been in places like Rwanda, where they have one-stop center. We can start now looking into artificial intelligence. We need to test, we need to have the DNA. We need to say how the one who said it's not me, we can say it's you, and we can do it immediately. We need to have talk about the judiciary. We need to have women at the police, women in the court, women who can be leading, because sometimes even within the military, we say that when you have a police women, the community will be more inclined to discuss with them than with his male police who will come to you and try to interact with you. So it's an engagement of the community watch, the traditional leaders, because if we wanted to dismantle the patriarchal system, we need to bring the traditional leaders in. So the multi-stakeholders platform, not just with the leadership taking the policy, the right policy at the right place, but also the mechanism like one-stop center when you can be tested, the hotline. We have seen even in Europe, there was hotline that you can call safely, but we insist in Africa on the community watch. I have seen in the Somali, even to defeat Boko Haram or Al-Shabaab in many places in the Sahel, that the community watch is there to defeat those who are coming to perpetrate violence in the community. So I think we have solutions. The issue is how do we work on the gain that we have made so far. As we have said in our 30 years right now, 25 since Beijing, where we have the peace tent for women, but where we know that violence is at the center of women, peace and security agenda. We need to make sure Security Council in New York talk about linking this COVID pandemic and the violence against women. We need to have that. So for me, I just wanted to say that these are some solutions that we need to put in place and measure. Thank you.
And just to very quickly follow up, do you think that what we've seen in some of the responses, both from President Ramaphosa, but also from governors in Nigeria, indicates that there is a turning of the political tide and that there is now political leadership willing to tackle this problem?
Yes, I think that President Ramaphosa, since the beginning, when he took power of the AU leadership in February, come very strongly, because he says South Africa is one of the countries where the women is not safe, and even before the COVID in February. And in his speech, opening speech, he said that I wanted to make it a priority and make sure that South Africa became the safe place for the women in the continent, not just for South African, but for the women in Africa. We need to put legislation, but we need to put mechanism, and on top of it, we need to empower the women in our continent. And when you talk about empowerment, you say the 10 years to come in Africa, we will have financial inclusion. We wanted the decade to make sure that women, private sector will come, we invest on women in the agriculture value chain. We wanted to see the supply chain in the food and so on, how we empower our business women, the SMEs and so on. We wanted to make sure that, and he launched a fund, by the way, with the ECA to make sure that we put resources in the SMEs of the women and also the digital. So we came with a huge program for the continent. Unfortunately, we are facing COVID, but we should not lose the gain of the commitment of President Ramaphosa that day with the all member states. When it comes to Nigeria, of course, the governors, which is Nigeria, the huge country, the governors have a say in their own region. And what we have seen in Nigeria, they came and said, this is going to be a state of siege, an état de siege in this, because we need really to make sure that in all our state, we work against those who are perpetrated violence against women. So clearly, Nigeria and South Africa are taking the lead, but the African Union is really taking the lead to tackle this pandemic.
Thank you very much. I want to turn to Paul Adepoju from The Lancet in Nigeria. Paul, you have a question on HIV/AIDS programs.
Yes, thank you very much. So my question is, around last year, we read about plans by PEPFAR to gradually phase out their funding for several HIV programs in Africa. Now with COVID-19 complicating emergency responses, including HIV and tuberculosis, what is UNAIDS doing to ensure that the support that African governments are getting are not taken away, and because of the additional pressure of COVID-19? Then I have a additional question for Dr. Moeti. The question has to do with, initially, the initial goal was to gradually reduce the number of cases by flattening the curves in several African countries, but the cases continue to increase. So what is now the new goal for WHO and other African countries in controlling COVID-19? Thank you very much.
Thank you for that, Paul. Turning first to Winnie Byanyima on that question for UNAIDS.
Yeah, well, you've asked a very important question, which is about financing health and in particular, financing the HIV response. It is quite concerning that today, most of the high burden countries, HIV burden countries, are dependent on aid to pay for their HIV response. You're talking over more than 90% dependence of the response being paid for by our friends abroad. We don't have a cure for HIV. We don't have a vaccine. But what we have are treatments and, of course, testing and preventing through using prevention technologies. But all of these are being paid for primarily by external donors. This is dangerous for us, considering that millions of our people are on treatment for the rest of their lives. And every year, last year, at least our report showed, there were 1.7 million new infections in that 1 year, 2018. So the list of people who need to get treatment for the rest of their lives keeps increasing because we are not winning the war on prevention. And that means every year our bill for keeping people alive increases, yet we are not working on pathways to sustain this ourselves. It's dangerous for us. That takes us also to the issue of local production. You know, I was looking up the data and I found that condoms, which are a prevention technology to prevent HIV, we use about 3 billion on our continent every year. In fact, we need 6 billion, but we get 3 billion. And of that 3 billion, only 10% is locally produced. 90% is also imported. So we are not only vulnerable because our people living with HIV are depending on supplies, money from our donors being kind to us. We are also unable to, we are not producing locally for our own needs. And Corona has shown us how dangerous it is to depend on external production to meet your health needs. You saw what happened with rich countries unable to find even the gloves and the gowns for their frontline workers. Frontline workers, nurses, doctors dying because they cannot be protected because production is not enough in the country. So our job is clear. COVID is telling us that we must wake up and find pathways to sustain our health needs and pay for our own responses. What are we doing as UNAIDS? One, we've been doing our number crunching and alerting governments and the whole world about the importance of not dropping HIV services because of Corona, because that will worsen the outcomes on health, but also worsen the burden on the governments to pay for an increased burden as a result of more infections and more deaths and so on. So that's one, alerting governments, giving guidance on how to keep the two struggles going. Two, we've been part of efforts to push hard for debt relief and debt cancellation so that Africa has a fiscal space to pay to invest in health. And we really want that money that is obtained from debt relief to go into health and not to be diverted elsewhere. Three, we campaign against user fees and work with governments to help them find ways of replacing the out-of-pocket that comes from poor families, to replace it with public resources, taxpayers' money, so that then people can get their health needs without their health care, without having to pay for it. What else do? We are working with PEPFAR. We are working with the Global Fund to stretch the little money which is there, to make it deliver for people in the most cost-effective way, efficiently. This is very important. One way to reduce our need for external resources is to use well what we have. And we already have a lot of studies that show us the wastage and the diversions of this scarce resource. So we work with national commissions to plan well for that money and to use it in the most cost-effective way. And now,
Winnie.
Okay, we are also pushing for a global public good for vaccines, treatments, and tests so that when they come, they are free for the whole world, including Africa. Thank you.
Thank you. Thank you so much. I want to make sure we've got 10 minutes to run on our time, and I want to make sure we get in a couple more important questions. I want to turn to Dr. Moeti in a moment to follow up on Paul Adepoju's question. But on a similar theme, we have Ruth Mclain on the line from the New York Times in Senegal. Ruth, can you just put in your question, please?
Sure, thank you very much. Thank you for all your important contributions on gender-based violence, and hopefully we'll be following up on that. I have a slightly unrelated question about oxygen and access to oxygen on the continent. In China, about 20% of all known cases of COVID-19 needed oxygen or more support like ventilators. And many hospitals in Africa have little or no oxygen. So even if only 10% of all cases in Africa need oxygen to survive, if they can't get it, it seems like that's going to be a lot of deaths. Is this a major worry, and what is the WHO doing about it?
Thanks. Now I'm going to turn to Dr. Moeti to answer that. Before we take her answer, there's a question on refugee camps, and we'll try and come to that just to draw today's discussion to a close. Dr. Moeti.
Okay, thank you. I think I'll start with the question about oxygen, which it's a real concern for us in terms of access to oxygen in the health systems in most African countries. We've worked with governments to try to help them improve the situation, but still we recognize that there will be gaps in access to oxygen in the region, and we are continuing working through the global procurement platform in WHO to help countries, for example, to have access to concentrators in the healthcare systems, in the ICUs in countries, so that people who actually don't need a ventilator but can have oxygen can then have their situation changed. This is indeed a problem. We've also worked, and I'm very pleased that the partnership of the African Union at the global level, mobilizing Africa's private sector, is also working to increase local production of oxygen on the continent so that it can be more available in the country. So we recognize this is a problem. What I think about the clinical management of COVID-19 in general is that we are finding more and more out about what are some of the causes of people needing to go on ventilators. For example, we found out that there is microembolism in a significant proportion of people who then go on to need a ventilator. So if you could explore much more the use of anticoagulants, so we might reduce that. I was very pleased to hear the information about dexamethasone also providing more hope in the management of people who are seriously ill. Perhaps this might decrease the inflammation of the lungs. They might need then less oxygen. So it's very much acknowledged that this is a problem. It's a challenge. There is work going on to improve access to oxygen on the continent. And then if I can turn to the question asked before about what is the situation now in the region and what needs to be done about it. I think it's true that overall we are seeing an increase in the number of cases of late in the African region. And as I said, our region, or if you like the continent with 54 countries or the 47 countries in the African region, there is quite a lot of diversity in the situation of countries. So we see in the region that 8 countries are responsible in the last week for about 85% of the new cases. And this includes countries like South Africa, Nigeria, Ghana, Cote d'Ivoire, and Cameroon. So if we're going to be differentiating what needs to be done in countries like this, and within these countries too, you find that it's not the entire country that's equally affected. There are so-called hotspots, provinces or cities that are more severely affected. And all this is happening in the context of countries now really feeling the pressure and some of what we've been discussing as well as the outcomes of the lockdowns to ease these lockdowns. So what we are advising countries is to do several things. First of all, continue to scale up the capacity to identify cases, their contacts, isolate them, and continue to help the population where it's possible to have access to masks, for example, to reduce the rate of infection and to carry out the social distancing in ways that don't exacerbate some of the other problems that we have talked about. Countries, in fact, then need to differentiate what they do where. And this means that data is very important for determining where are the places where the rate of increase of cases is most intense, where these interventions need to be put in place. So we are recommending scaling up the public health interventions, continuing to provide care and treatment, of course, helping people, educating, enabling the population to help itself. We think it's very important, for example, for people to be provided with free masks where their socioeconomic status does not enable them to have access to masks. It's important for governments to monitor and see that the behaviors that they're trying to encourage in communities are being followed, to understand what problems people have, to follow some of this advice in order to make the situation better, and to monitor, adjust. If you have relaxation of the measures and you see an uptick in the cases, see what can be differentially then reinforced so that you get on top of the situation. And very importantly, manage this dilemma and balance between dealing with the virus and its transmission, and also dealing with some of the impacts which can exacerbate other health problems in the population.
Dr. Moeti, thank you very much. As we reach our final 4 minutes, I want to see if we can turn to Johannes Dietrich from Frankfurter Rundschau. Johannes, can we get you on the line?
You got it also almost right. Thank you very much. That's great that I have a chance. In the light of, it's a question to Dr. Moeti. In the light of the upcoming World Refugee Day, I would like to know what the situation is now in the refugee camps in Africa. Apparently in some it has actually arrived. There were a couple of cases, but there wasn't, so far, there wasn't the big outbreak in any refugee camp, perhaps in Darfur. I just want to, whether you could give me a little bit of an update and overview of the situation in the refugee camps. Thank you.
Thanks for that, Johannes. In our last 3 minutes, Dr. Moeti, can you bring us up to speed on the latest, if you have it, from refugee camps?
Okay. Yes, I think we're aware of cases and the spread, a cluster of cases in 3 camps in South Sudan, apparently, and other sporadic cases in some camps in the Sahel region. Of course, this is a matter of great concern because of the conditions, if you like, and the situation in which people are living in refugee camps, the type of housing that they have, and the challenges that would arise then for interventions like social distancing. We're working, WHO is working with other partners, with UNHCR, with the civil society, humanitarian partners, and here we're putting a lot of hope in the global humanitarian response plan that was launched by the Secretary General to mobilize the resources that are needed to make sure that the interventions that need to be put in place are put in place in refugee camps, because we have here situations of particular vulnerability. We think this is extremely important to be done, and we are working with the partners who are involved in the humanitarian situations to make sure that, particularly in refugee camps, the most appropriate interventions are put in place to prevent the spread of infection.
Thank you for that. We're nearly out of time. We have, I think we can just squeeze in a brief closing comment from both Winnie Byanyima and from Bineta Diop. Winnie, can I just ask you to perhaps sum up the message you'd like journalists to take away from today's briefing?
It is that we have learned from 25 years of fighting HIV in the HIV movement that to beat an epidemic, you need an evidence-based, multi-sectoral approach that brings the whole of society on board to fight. And that most importantly, communities can defend themselves, empowering them, putting them at the center to design their own prevention and tracing and isolating strategies works. And lastly, that human rights matter. Avoiding discrimination, stigmatization is important. Those things will help us to win in Africa.
Winnie, thank you very much. And Bineta, can I just turn to you for your last 30-second closing thought, your takeaway from today?
Thank you so much, Adrian. One thing is the African women are mobilizing the leadership to contribute, and this is what we think is matter, leadership in the entire world. So the women leaders are mobilizing to impact and accompany what Winnie have said when it comes to the national level, giving guidelines to the member states on how, but also contributing in the communities. So women are mobilizing in the continent. We don't leave it just to those who are the leaders, male leaders in this continent. Professor Schwab have said the world needs to reset. And when we look at Secretary General Guterres on the new world order, where multilateralism and Africa have a seat, we need to look at that. But for us, we are saying we need to new social contract. Because when you look at the education system, you look at the health system, you look into all the different systems that exist, we need to make sure that all the partners, including private sector, we are together on the same to discuss this new social contract. Thank you.
Bineta Diop, African Union Special Envoy, thank you very much. To Winnie Byanyima, Executive Director of UNAIDS, thanks to you for joining, and to Doctors Moeti and Yao for their work and for joining this briefing, and to all of you for coming in and being part of it. Our thanks, and we hope to see you at the next briefing. From Geneva, thank you very much.